Mental illness as states of mind. A more simple way of looking at mental illness is to see it more as a state of mind rather than as a chemical imbalance. What do I mean by this? Well, in the end, when someone is mentally ill, their own state of mind is what's causing their suffering. It's not that the person is ill throughout their body, although there is underlying subconscious things going on beneath the surface of the mind. But in the end, the mind is causing the person's illness or suffering. So all mental illness can be categorized under that the own person's mind is causing the suffering in the end. Now, what is causing the suffering? Their state of mind is causing their suffering. And what would that be? It's their thoughts that are causing their suffering. They're thinking to themselves. It's the repetitive thoughts in their head. In a state of depression, for example, it's the repetitive hearing of statements that they're saying to themselves in their mind. I feel worthless. I feel depressed. I don't want to go on anymore. I can't get out of bed. This is the illness. What these people are doing is just talking to themselves the whole time during the day. Not like I'm talking to you, although it's the same thing. It's those same words, I feel depressed, I feel worthless, but not saying it out loud to the other person, but saying it to themselves in a vicious cycle, so that their whole entire day, that's all they can hear, and then they believe these things to be true, and then they become in those states. This goes also for mania, which is simply shutting off thinking. When there's no thought in the mind, and there's no words anymore of I feel worthless, I feel depressed, then the mind is a blank slate. Of course, this feels great, and the patient's happy all day. And actually, even the sensations that come in make the person feel that the universe is speaking to them in some way. Because without all the word cycling in their mind, all the extra sensations coming in, sound, smell, taste, etc., are heightened. So this is the state of mania. The only problem is when they turn their thinking mind back on, the same thoughts come in again. I'm depressed. I feel worthless. So now there's only two states. The state of mania and the state of depression, or the state of thoughtlessness and the state of thought. So this can also be said for schizophrenia, where schizophrenia is a state of mind where there's visual and auditory hallucinations going on in the mind to the extent that they overpower the person enough that it becomes their own world, like a dream in an awake state. This is why it's very difficult for a doctor or any other person to, quote-unquote, reach that person. Because there's the patient, or the person, I should say, is so engaged in their own mentally created world that anything from the outside is hard to process because it's overwhelming, just like a dream. It's an overwhelming state of mind. And so to see mental illness in this way is a very simple way to see it, because in the end it's the thinking mind that's causing the person suffering, whether they be auditory thoughts, visual thoughts, what have you. So this is what's causing the mental suffering. The person is in a state of mind and they're believing what their mind's telling them. And by believing what their mind's telling them to be who they are, then they become that. But that's not who they are. They are not their thoughts. But rather, they are the beingness that produces thoughts. And once they come to this understanding that they're not who they think they are, but rather they're the entire being, like we all are as human beings, we're not who we think we are, but we are actually the beingness that does the thinking, or the existence itself.